Diary of a Black Man, Episode 4. Today's story starts in 1998 when I first moved to New York City. I was hanging out with one of my good friends, and he wanted to go get a haircut. And I usually have the same barber that I was going to for the 2 years that I was living in New York, but he said, try my barber. So I decided to go. And when I went, he gave me a good shave, but the next day I noticed a little bump coming right about here, right where he kind of lined me up with a razor. I didn't pay much attention to it, and then a day or so, I saw the bump starting to get a little bigger and it started to get a little white. So my naive self decided to try to pop it. And when I popped it, my whole face swelled. One half of my face was swollen, half my lip. I could barely speak. I tried to endure the pain for a few hours, and then I decided, this needs medical attention. So at that time, I was living in East Flatbush, borderline Brownsville, New York, which is predominantly a Black neighborhood, a lot of Caribbean people, a lot of people of color in general, but, Black neighborhood. And I knew on my commute to work, there was a hospital nearby called Brookdale Hospital. So I decided to go to this hospital to see if I could get this problem resolved. My naive self, being from Canada, feeling that all hospitals are the same, I had the shock of my life. I walked into Brookdale Hospital and it was just pandemonium. All right, there's people to me, look half dead on IV, sitting in the waiting area. I've never seen that before. This is the waiting area. They're not even admitted into the hospital and they're peeling over. So I immediately went to the front and told the lady, look, I think I have an infection. I need some antibiotics. Can somebody help me? Immediately, she abruptly said, show me your eyes, show me your insurance. Luckily, I was working at Chase Bank at the time. I had great insurance. I showed her the card. She said, oh, okay, sit over there. I sat there and waited hour after hour and nothing was happening. Finally, I couldn't take the pain anymore. And I just got up and literally I walked past her into the hospital, the patient area now where they treat people. And I just saw people scattered in the hallways, once again, side by side lying. And I just grabbed any doctor I could. And I said, listen, I just need somebody to attend to my face. It's hurting. I know it's infected. Please, can somebody help me? They brought me into a room. This white male doctor came in there shortly after, and he came over and went immediately to touch my face. And I said, hey, stop. I just saw you leave another patient. Could you at least wash your hands? I'm telling a doctor to wash his hands, to touch my face. So he did. He washed his hand and he said, oh, you have an infection. And I said, I know. So once again, my naive self said, can you just give me the antibiotics so I can take them and, and clear it up? He said, this hospital, we cannot give out medicine like that. We can give you a prescription, but we cannot give you medicine to take home. And I said, I don't need 24 pills. Just give me 2 pills to hold me over. Now it's in the middle of the night until I can get to a pharmacy to get the full prescription. Sorry, sir, we can't do anything. All I can do is write your prescription. And I said, you have the pills there and you can't give them to me? He said, no, I can write you a prescription and you can go. So fine, I went home. This is now spending over 10 hours in the hospital. It's 4 a.m. I had to wait till 9 a.m. to go to the pharmacy. I was the first one to arrive at the pharmacy. I gave them the prescription. I gave them my insurance. And they said, the doctor that wrote this insurance is not part of your plan. Once again, the naive Canadian in me was like, I don't even know what that means. A doctor wrote this prescription. Here it is. Can you fulfill this prescription? In order for us to fulfill this prescription under your coverage, you're going to have to find a doctor under your plan. Lucky the pharmacist was nice enough to say there's a place center for your plan, not far down there. Go there, get them to rewrite the prescription. Okay, we are now over 12 hours, 14 hours in, and I'm still in pain. My face is still swollen. I walked down to this place, showed them the prescription. They now, because of coverage, insurance, liability, they want to give me a full checkup. And I said, I don't need a full checkup. I just need you to rewrite on your paper this exact prescription so I can bring it to that pharmacy so I can get this pill to heal my face that we all know is infected. After pleading and begging, finally, a lady of my color, and luckily she was from the country that my family's from, which is Barbados, was able to find a doctor and rewrite the prescription. I immediately went to the pharmacy, and it took me over 18 hours to take the first pill to heal my face. Now, that was over 20 years ago, and I'm sure you're asking me, why are you telling a story that happened over 20 years ago? Well, let's fast forward to today, okay? And let's now Google that same hospital, okay? Google that hospital. It's called Brookdale Hospital, all right? When you Google that hospital, what comes up is CNN did an article on that hospital at the end of March 31st regarding the COVID virus. It says, inside a Brooklyn hospital that is overwhelmed with COVID-19 patients and deaths. Google it yourself. A Brookdale University Hospital Medical Center in New York, the ICU is at capacity. Patients' beds line the hallways of the emergency department, and the morgue is overflowing. COVID-19 Dr. Moleta says has turned the Brooklyn-based hospital into a quote-unquote war zone. A medical war zone, Moleta, an emergency room physician at Brookdale Hospital, told CNN. Every day I come, what I see on a daily basis is pain, despair, suffering, and healthcare disparities. Now, I mean, this to me is very hurtful because 20 years ago, what I experienced now has elevated to what's happening today. When people ask yourselves, why are people of color, brown and black, dying in large numbers from this COVID-19 virus? It's not to do with the melanin of our skin. It's not to do because we're not protected and there's some imbalance between us compared to our white counterparts. It's simply access, okay? It's simply access. These hospitals that are built for us in our communities, and they know which communities are black and brown versus which are white, they don't give the same level of resources. They don't give the same level of medical professionals. So we're denied certain basic things that other hospitals have. So we're not being able to get the proper care that we need to heal. If I experienced a minor infection and it took me 18 hours to get a pill, I can't imagine what people are going through in these under-resourced, underserviced hospitals. They were showing pictures of Brookdale Hospital where they had to duct tape some rooms, and death is lying in the hallways. So I say this to say, once again, as a black man, as a person of color living in a disenfranchised neighborhood, are the access really the same in the United States of America? Ponder on that. Have a good day.